Go, Dr. Hassan. اتفضل. Go.
Hello, I'm Dr. Hussein, one of the doctor today. Can I confirm your name and age, sir?
Yes, I am. Yes, doctor. I am Fatma, 30 years old.
Okay, sorry, madam. Okay, and can you tell me why you come today to your clinic?
Yes, doctor. Today I have problem in my eye. Has changed in color of my eyes since started 5 days ago, and I visit the GP, and they informed me to visit you today, doctor.
Okay, thank you very much for your kind information. And just for sure that during our conversation, I may take some note, and I assure you that that will remain totally confidential.
It's okay,
And
doctor.
can we continue now?
Yes, doctor. No problem.
Okay, is it the only for these 5 days, or is it happened before that 5
Yes,
days?
doctor. First time.
It's the first time.
Yes.
So, so when you notice it first?
What doctor?
So when you notice it first that your eye become changing coloring?
Yes, as I told you, this change in my color and increase with time, doctor.
Okay, and is it progressively increasing? What do you
Yes,
think?
doctor. Yes, doctor.
Okay, and do you have any other discoloration of the any other body part? Do you think hand or feet like this?
No, doctor.
Okay, only your eyes.
Yes.
Okay, and do you have any other condition?
No, doctor. I have some tummy pain, doctor.
Okay, and is it also for the 5 days or the
Yes.
longer than this?
With
Also,
discoloration, doctor. Yes, with my change, doctor.
also for 5 days.
Yes, doctor.
Okay, but tell me the nature of this pain. Is it what about this pain?
Colic pain, doctor. Colic with as colics.
Or any specific side of the tummy or the whole part of the tummy?
It's doctor mostly in the all my tummy, but most increase in the upper abdomen, the upper tummy, upper part of tummy.
Okay, your upper part of the tummy.
Yes.
Okay, and in the meantime, do you notice any weight loss?
No, doctor.
Change in the weight?
No, doctor.
What about your appetite? Is it increase or decrease like this?
When this problem start, doctor, start to decrease, doctor. No, has no appetite to have any meal, doctor.
Okay, I'm really sorry to hear that. And do you find any relation with that pain with food, like this type of thing?
No, doctor.
No relation with the foods. Okay, and do you notice anything like that? That when you bend forward, the pain is increase like this or decrease?
No, doctor. Any side, any side, anywhere.
Okay. Do you notice any discoloration of your urine, your water
No,
work?
doctor. No, doctor.
No discolor. Okay. And do you notice any itching in any part of your body?
Itching? No, doctor.
No itching. Okay. And and you said that your weight is normal.
Yes.
Okay. And what about your bowel work? Is it normal?
Yes, doctor. No problem.
No, no alteration in the meantime.
What, doctor?
No alteration in the meantime.
No, not change.
Okay. In the meantime, do you travel anywhere?
No, doctor.
Not travel anywhere. Okay. And you said that you doesn't suffering from any other medical condition that I should have aware of.
No, doctor.
Okay. Do you take any medication?
No, doctor.
Okay. Are you allergic to any medication?
No, doctor.
Okay. Can I ask you some more personal question?
Yes, doctor.
Okay. Are you married?
Yes, doctor.
Okay. Do you take the oral contraceptive pills?
Yes, doctor.
Okay. How long you take the oral contraceptive pills?
10 years.
For 10 years.
Yes.
Do you recently change the dose of these drugs, like this type of things?
No, doctor.
Okay. And other than these, do you take any other drugs other than these oral contraceptive pills?
No, I didn't take anything.
Okay. And do you notice any swelling in any part of your body?
Yes, mild swelling, doctor. Yes.
Oh, can you please tell me which part of the body is swelling?
And all my tummy, doctor, I noticed mild increase in swelling in my tummy.
Okay, madam. I'm really sorry to hear that. And do you notice any bloating or you said the distension, and do you notice any fullness of your tummy like this,
No, no,
or
no,
heaviness in your tummy?
no, no,
Okay, and do you notice any swelling in your feet?
no, doctor.
No swelling. Okay, and uh, do you ever vomit out?
Throughout, no, doctor. Throughout.
Okay, thank you very much. And now I'm going to ask you some question that may be not directly related to your symptoms, but just make sure that we doesn't miss anything.
Yes, doctor. Yes, doctor.
And before come to this point, any other family member suffering from this type of things, this type of yellow
No,
discoloration?
no, I am first. No, doctor.
No, it's only for you. And any family history of note that you wanted to tell me? Your father,
No,
mother, or other?
no, doctor. Nothing.
Okay. And other than this yellow discoloration, do you notice any tiredness?
Tiredness? Yes, doctor. I am feel fatigue and tired after this problem. Yes.
Okay, any specific part of the day or throughout the day you feel tired
All the day. All the day, doctor.
all the day? And do you notice you're getting pallor day by day? This
Better, no, doctor.
no pallor. Okay. Do you have any soreness in your mouth or
No, doctor.
your private part? I'm sorry to ask you that.
No, no,
No soreness.
no,
Okay. Do you have any headache?
no, doctor.
Any vision problem?
No, doctor.
Okay. Any dizziness when you stand?
No, doctor.
Okay. Any tingling, numbness in your hand and feet?
No, doctor.
Any chest problem?
No, doctor.
Okay. And coughing or coughing out of blood,
No cough blood, doctor. No,
chest pain,
no,
giving
doctor.
deep breathing like this. Okay. Any racing, pacing of your heart?
No, doctor.
Okay. Is it happen that your leg is swollen in the morning like this?
No, no,
And sometime you wake up in the night and gasping for air like this?
no, doctor.
Okay. Do you find any breathing difficulty?
Bleeding? No, doctor.
Okay. As I asked you before, the color of the urine. Do you notice any change in your color of the urine?
No, 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 doctor. No change in color.
Any change in the amount?
No, doctor.
Any frothiness?
No, doctor.
Okay. And any burning sensation during your water work?
No, doctor.
Okay. Do you have any joint problem?
Sometimes, doctor, I have small joint pain, doctor, in my hand.
Okay. And specifically, which joint is involved? Can you tell me?
In my hand, doctor. No, in my hand.
Okay. And how long are you suffering from this joint pain?
About 2 years, doctor.
2 years. Do you have any diagnosis for this reason?
No, I don't. I take some analgesic only for the pain and not care about it.
Okay. And is it increase in the morning, stiffen in the morning like this?
No, doctor. No, doctor. No specific time.
Okay. Do you have any rash in your body?
Sometimes, yes, doctor. In my face, yes,
Okay. Is it increase when you exposed to light, exposed
yes,
to sun? Sorry.
yes, doctor.
Okay. And uh, uh, and do you have any other rash in any part of your body other than this face?
What, doctor?
So, any rash in any other
No.
body part
In
other
my
than
face
this
only.
face?
In my face, no,
Okay.
no, not my face.
Do you notice any hair loss in the meantime?
No, only in my face, doctor.
No. Do you notice any hair loss in the meantime?
Hearing loss?
Fall of hair?
Yes,
Yes.
sometimes, doctor. Yes, I feel also my hair become full more than before.
Okay. I'm really sorry to hear that. And do you find difficulty to stand from sitting position like
No,
this,
doctor. No,
or any muscle pain?
no, doctor.
Okay. And I ask you some a personal
Two
question.
minutes. 2 minutes remaining.
Okay. Do you have any pregnancy loss, madam?
Yes, doctor.
Okay, so how many and which
Two,
time
two, two
of
times.
pregnancy?
Two times.
Okay, okay, I'm really sorry to hear that, and I
Thank you, doctor.
will help you regarding this. And do you have any clot problem previously?
No, doctor.
Okay, and can I ask you, do you have any specific concern in this time?
Yes, doctor. I want to know what happened, doctor, to me, doctor. What my problem?
Okay, after talking to you, I need to examine you, and after talking to you, I have a possibility in my mind that you have a condition in medical term. We call it antiphospholipid syndrome. Don't bother yourself by the name. It's a condition in which there is a spontaneous clot formation in the blood channels, and unfortunately, I'm afraid to tell you that this clot is formed in a particular vein in your tummy, and that produce this type of yellow discoloration and tummy pain. And hopefully we have a very good management for this condition. And now I'm going to want to admit you. As I said, it's a serious condition. If it is untreated, it can be progress very badly. And hopefully I find your cooperation for admission. And this is a manageable condition. Do you have any other concern?
So so my problem, doctor. What I have now clot in my conduit.
No, it's not your kidney. It's in a you
Conduit.
can say this. It's in a vessel, and that produce this type of yellow discoloration and tummy pain.
Yes, doctor. So we will admit you as you will admit me, doctor.
Yes, yes, definitely. I will admit you and immediately run some investigation and then give the treatment because we have to thin out the blood to prevent any further clot formation.
It's okay.
Is it okay for you?
Thank you, doctor. Thank you very much, doctor. You are helpful. Thank you.
Okay, thank
So,
you very much.
thank you, Dr. Hussein. What's discussion with examiner? What's your differential diagnosis, Dr. Hussein?
So my first differential diagnosis, this is a case of Bartholin syndrome, which is secondary to antiphospholipid syndrome. And I also suspect this lady also may have SLE, and this is my primary diagnosis.
Yes.
And
Uh,
other condition I can consider that could be autoimmune hepatitis, and I can also consider the primary biliary cirrhosis or primary sclerosing cholangitis, although I doesn't find any gastrointestinal symptom in this lady.
it's okay, doctor. So, what we are doing investigate this patient?
So to establish my diagnosis, first of all, I wanted to do a ultrasonogram, a specific focus on the splenic vein and ecotexture of the liver and whether there is any congestion or not right now. And for confirmation of the diagnosis, as I said about the antiphospholipid syndrome, I wanted to do the anti-cardiolipin antibody and antiphospholipid antibody. And to the secondary finding as me for ASLE, I wanted to do the anti-nuclear antibody screening, anti-double stranded antibody, and C3C4 level.
It's okay.
And
So,
to
good, excellent,
to see
doctor.
the
Go. Yes, continue, doctor. Continue.
to see the complication, as I said, this could be complicated as clot formation. I wanted to do the INR and prothrombin time. And regarding this, I wanted to manage this patient by form a multidisciplinary team, including my consultant and the gastroenterologist, and introduce the blood thinning medication as early as possible after confirmation of the diagnosis.
It's okay. Thank you very much. What's the treatment plan of management?
So in this condition, I think first of all the low molecular heparin to increase the INR, and then we can convert the low molecular heparin to the warfarin, and this is all.
It's okay. Thank you, Dr. Hussein. Thank you very much. Before you finish, please, what you are differential diagnosis you are put before enter the station?
So as this was a 30 years lady, my differential diagnosis was about primary biliary cirrhosis, primary sclerosing cholangitis, and autoimmune hepatitis. And these three are my differential diagnosis in the page before entering the room.
Yes, only يعني you write in the paper all this, only this.
Yes.
Yes, it's okay. Thank you, Dr. Hussein, for.
But antiphospholipid syndrome was not in my differential before entering the room.
You wrote antiphospholipid syndrome.
No.
It's okay.
It wasn't my differential.
Okay. وانتيفوسفوليبيد syndrome what you are يعني antiphospholipid syndrome what you were doing يعني what's the يعني patient what have what's the disease have.
So this patient, first of all, I wanted to consider the antiphospholipid syndrome because
Yes.
she also have the feature.
Yes, she has antiphospholipid syndrome. It's okay. I with you. طب antiphospholipid syndrome what's the complication of antiphospholipid syndrome in this patient? What's the name of the disease in this patient?
As I said, the Bartholdi syndrome, the hepatic vein thrombosis.
But care, yes, but care syndrome. It's okay, but care. It's okay. Good, Dr. Hussein, you're doing, but I just put you some help you in the last. Told you it's it's okay, excellent. You are doing conversion your very good. Now we are start to discuss interesting case, very interesting case. It's okay. I think very important. As we told before, before you enter the station, very important to doing your good differential diagnosis to help you to remember or to direct you. It can help you what's your direction and to be organized in your mind. It's okay. Because as I told you before, what you write in the white paper, maybe the examiner sees this paper and know you wanted to ask something or you forget something. Can maybe help you, but better to write organized and put all your try to gush all your information in this paper and try to write what your differential diagnosis. This, as I told you before in one session, this problem has يعني this in 5 days يعني means this time 5 days is sudden problem I say أو يعني acute أو acute problem. Any acute problem or any acute something happen as epilepsy or headache or jaundice, you have to ask about what happened before يعني what's the causes of this jaundice. You have as we take before, what's the causes of the jaundice. We take before the jaundice, before the main problem is the jaundice. What's the cause of the jaundice? We have 3 types, maybe pre-hepatic or hepatic or post-hepatic. Pre-hepatic may be, as we told, the blood disease, as hemolytic anemia, autoimmune hemolysis, or BNH, paroxysmal nocturnal hemoglobinuria, or maybe travel malaria. So any cause hemolysis in the blood. So you have to ask about the pre-hepatic problem. Any bleeding tendency or any bleeding disease. So this pre-hepatic. So you have to be organized in your thinking. The first thing is pre-hepatic or problem in the liver. So in the problem in the liver, the most common is viral hepatitis, very important, viral hepatitis, alcoholic hepatitis. So okay, any metabolic liver disease as Wilson hemochromatosis, maybe the problem is hemochromatosis. So okay, or autoimmune hepatitis as we told, or malignancy, very important. You not ask about weight loss, fever, and bumps, lumps. You have asked about malignancy, and very important vascular problem as Budd-Chiari syndrome. Budd-Chiari syndrome very important for surgeons. And in a drug can cause jaundice as amiodarone, methotrexate. Okay, and post-hepatic as is luminal, so stone, maybe stone. Okay, obstructive jaundice, or maybe primary biliary cirrhosis, so okay, or primary sclerosing cholangitis, so okay, or extraluminal as anything pressure on the human, maybe malignancy or lymphoma. So if you put your differential diagnosis before the session, I think it's very helpful for you. Really, yani, I think if you write all this question with systematic review, I think you are not lost everything. So any problem, you have to put your differential diagnosis. As we told, is how to think pre-hepatic, hepatic, and post-hepatic. So okay, now we start the case. Good evening, Mrs. Fatma. Please, I want to ask the Dr. Hussein, not ask a patient. Please, you inform me who are. You know, ask. You can ask here. You are Mrs. Fatma and you are 30 years old. Okay, not ask here to inform you. It's better. Yeah, it's my opinion. Yeah, it's okay. So tell the here. You are Mrs. Fatma. Yes, good morning. I received the letter from your GP informing me has problem in your eyes. A very discoloration in your eyes. Please, can you inform me more about this problem? Yes, doctor. I have the problem. Start 5 days ago. I am sorry for you, Mrs. Fatma. Can I will write some notes. The notes is totally confidential. It's okay to you. I consulted with you. It's okay to you. Yes, doctor. So start you how please inform me your condition. I start from 5 days. Use discretion, and I visit my GB and refer me to you. It's okay, doctor. When it started, so as any analysis of the complaint, when evaluation discretion, you take to start. When it started, suddenly or gradually, on and off for all the days, in both eye on one eyes. It's okay. Um, Increasing or decreasing or the same. You notice anything increase it or anything decrease it. It's very good. You receive any medication for it? No. It's okay. And also, Mrs. Fatma, you have informed me you has tummy pain. Please, can you inform me about it? Yes, doctor. It also start when it started, suddenly or gradually, on and off all the time. Where the site? In all tummy or on specific part of the tummy? Decrease or decrease or the same? What's the character of the pain? Colicky or dull aching or sharp? Colicky, doctor. What's the grade or the score or pain score of this pain, Mrs. Fatma? From 0 is less score and 10 is maximum score. Is doctor about 6 or 7, doctor? Is pain radiate to anywhere, doctor? Mrs. Fatma? No, doctor. Is this condition happened to you before? No. So is first presentation. Is anything increase your pain? No, doctor. Is anything relieve the pain? No, doctor. I try some medication, analgesic. What's the name of the medication you take? I take Spartan. Did improve your pain? No, doctor. So okay. So you now, as you told, if your case in your now analysis, what you have in what about information? Maybe guide you what your diagnosis, but maybe no. So now you are in the case of the abdomen. Try to finish all abdomen from above to down. The abdomen starts from the mouth until the leg. So, okay. So you have any problem uh, in your swallowing? You have problem in your swallowing? No, doctor. You have any heartburn or have any heartburn or tummy pain? Heartburn? No, doctor. You have any change in your bowel work? No, doctor. You have any increase swelling? You have swelling in your tummy? Yes, doctor. I have some tummy. This is ascites. You have to have the ascites decrease the swelling of the tummy. You have any stention? No, doctor. It's okay. Have any swelling in your leg edema? No, doctor. So you are finished now the abdomen case. You have any problem with passing any blood in your bowel? No, doctor. What about any or your any history of the getting sick or feeling sick? Any history of throw up blood before? You ask about hematemesis or uh, bleeding per rectum. So okay, you are finished abdomen now. So we will start to hemolysis the analysis the what you write. You are taking prehepatic and hepatic and post-hepatic. And prehepatic also about anemia. And have a history. You are become pale. Pale. Anyone told you are become paler more than before? Very important. You are having any fatigue or any headache? It's okay. About any dizzy attack? No. So this sign, all this sign of the anemia. Racing of the heartbeat? No. You history of the blood loss before? No. Have a history of blood receive blood transfusion before? No. So okay, the blood. What about your any female? Please, as I told you, any female, please not forget some question. Please, can I ask a private question? Yes. What about your period, doctor? Period, Mrs. Fatma? Yes, it's regular. It's okay. No excessive bleeding. No. Any bleeding from anywhere? No. You have to search about the sign or search about the source of the bleeding. You have any bleeding from anywhere? No. You have any bleeding tendency or bleeding disease? No. Any family history of bleeding disease? No. It's okay. Any history of blood transfusion? Any history of blood loss? No. It's okay. So now you ask about the anemia. So ask about the blood transfusion for thalassemia, any blood disease. It's okay. It's okay. So ask about you have fear about maybe malaria problem, malaria. So any traveling? No, doctor. Ask about the viral hepatitis. Very, very important. What's the causes of the viral hepatitis? You have to ask. Now you are finished pre-hepatic, you go hepatic problem. What's ask about the viral hepatitis? As ask in the HIV, as an ask in the any sexual transmitted disease. You have to ask about any surgical operation. You have any tattooing, any dental procedures, any needle sharing, any piercing. All these causes can be HIV and viral hepatitis. Very, very important. It's okay. Any fever before? No, doctor. Ask about another causes of the metabolic. You now ask about alcohol, history of alcohol to alcoholic hepatitis. So alcoholic hepatitis, viral hepatitis, malignancy. You have as a fever, weight loss, bumps and lumps. There's no malignancy. And ask about the metabolic cause, maybe hemochromatosis. Yeah, what about in diabetes? No, doctor. In a tender skin? No, doctor. Maybe if the main if leg swelling, it's okay. Shortness of breath, this hemochromatosis. And malignancy. And very important as our case is vascular cause, butt carry. Butt carry is jaundice with abdominal pain and ascites. These three things very important in the butt carry. The butt carry is blood clot. Blood clot. So you have to ask in history of the blood clot before? No, doctor. In history of family history of blood clot before? No, doctor. Very, very common important that in any female you ask about any history of the miscarriage before? Yes, doctor. Very, very important. If you not ask, she not tell you. And the oral contraceptive pills is very important. This is one of the complication of this blood clot. And you are search about that. If you are thinking about carry, you ask about that. What's the cause of the cause of this blood carry? This antiphospholipid due to SLE. So you want to ask any SLE, mouth sore, private sore, and the butterfly rash. Is rash in your face? Yes, doctor. Joint pain? Yes, doctor. What about this cause? This antiphospholipid syndrome. Drug, very important. Drug induced hepatitis. You take any drug? No, doctor. And the drug, as you told, a drug, and also herbal medication. You are take me drug? Yes. Take any herbal medication? No, doctor. Autoimmune, autoimmune, any host autoimmune can come with another autoimmune disease. And rapid review in the from above to down in the above in the headache, drowsy, dizzy, numbness, weakness, loss of sensation, loss of your control of your water work or bowel work. This neuro, chest pain, shortness of breath, any cough of blood, heart racing of the heartbeat, chest pain. Also بس one ask خلاص, not ask again. Any swelling of leg, it's okay. And الtummy خلاص, we are finished. الwater work, and change your water work in color and amount. And any surgery before, any operation before, any muscle pain, so joint pain, traveling history خلاص we ask. In medical history, any problem, hypertensive, diabetes, no. Surgical operation, family history, drug history, social history, what your work, teacher can help you, and smoking, very important. So now, with discussion. So what, doctor? What your concern is, Fatma? Please, doctor, what I have, doctor? From our discussion today, I need to do more investigation and will examine you. But from our discussion today, I think you have some problem in your blood. Physiological discoloration and tummy pain and increased tummy swelling, condition called butt carry syndrome. This condition is called from blood clot in one of the liver conduit. Blood clot in your liver blood vessels is called conduit. So it's called is the blood clot in one of the blood conduit in the liver or blood supply, liver or blood conduit of the liver. It caused due to some disease called antiphospholipid syndrome. This called SLE. Maybe not from all this. Maybe it's called blood carrier syndrome. Is blood clot in your liver conduit due to your problem has SLE because you have this rash and this joint pain. So, it's urgent condition. I'm sorry to inform you this urgent condition. I have to admit you to doing urgent investigation and giving you the proper plan of management. Okay, and also Mrs. Fatma, I will refer you. You have to told the patient. First thing you have told the patient, I admit you, and something also in multidisciplinary team. You need to do multiple in the form of GIT doctor and internal medicine doctor, and about the oral contraceptive pills. You have to stop this oral contraceptive pills, and I will refer to you to your obstetrician to change this medication to another type of the conception for this, because this oral conceptual base increase the incidence of the this clot. Now it's finished everything about the condition. My message, as any case for female, please not forget, ask about a period, very very important, and history of miscarriage, and the oral contraceptive pills, and have any rash or small pain, because this female may have most common SLE in the female, and the SLE here is a key. If you not ask about the SLE, you not answer the case. I think it's very important case. Please not forget. Also, with what's your differential with examiner? You have to ask about what's your differential diagnosis. First diagnosis is Budd-Chiari syndrome. Second to antiphospholipid syndrome, which second to is LE, and also maybe bleeding tendency or bleeding disease, but from our discussion, there is no bleeding disease, or hypercoagulable state. So, okay, so what's the management plan? Investigation, what are doing? So, are doing basic investigation and specific investigation. Basic investigation, CBC, RFT, LFT, coagulation profile, X-ray, ECG, and specific investigation for our condition is ultrasound in the abdomen. So, okay, and are you doing maybe doing CT abdomen? So, okay, and maybe doing autoantibody lupus anticoagulant and anticoagulable and sympathilia screen, and maybe take sample from the swelling ascites, maybe take sample from the ascites. And management, pharmacological and non-pharmacological, non-pharmacological, patient education and patient counseling. So, okay, and occupational support and social support, and pharmacological in the form of anticoagulant and thrombolytic and diuretics for ascites. And if patient treated or not respond, can doing paracentesis or liver transplantation. You are finished the case of the Budd-Chiari syndrome, one of the important case in the case scenario. I think it's okay. So now we are take first case is Budd-Chiari syndrome.